Welcome to Help! I Have Kids. I'm your host, Pam Marshall, a mom of 5 and a pediatric occupational therapist with over 35 years experience. This podcast is designed to equip you with practical tools, insights from experts, and real-life stories. Because at the end of the day, you are the head of your child's care team. Each week, you'll hear from pediatric experts and fellow moms like you that will help build your confidence. They'll offer clarity and empower you to make informed decisions that work for your whole family. Today, we're joined by 2 incredible guests who I know and are friends, but also physicians of mine. This is Dr. Erin and Dr. Geoff. Welcome to the podcast.
Thanks for having us.
Thanks. Yeah. Well, we're excited today. I want to hear a little bit about you first. Tell our listeners who you are and what you do.
Yeah. Okay, great. Well, thanks for having us.
Sure.
I'm Dr. Erin. It's my husband, Dr. Geoff. We own Olive Health Direct Primary Care. And so we are a membership-based, affordable primary care clinic in Lexington. We see patients of all ages. And we've been doing it about 7 years now. So
it's amazing.
Yeah, it's nice. It's a great way to spend time with people and just get back to doctoring.
Yeah.
It's different than the traditional practice.
Well, I can say I love it. I love the time I get to spend with you. Oh. Dr. Erin's my doctor.
Thank
and
you.
I love how you take care of me, and it's really an honor. And
Thanks.
Anyone in our company who takes our medical insurance gets this gift of Dr. Erin and Dr. Geoff taking care of them. And I know, Dr. Geoff, you take care of my husband, and he loves your care
Oh, well,
too.
thank you for saying so. I like him too.
Great.
He's a very nice guy.
Yeah. So I highly recommend them. And I know a lot of people are struggling insurance-wise these days because premiums are so high, and sometimes people are going to direct primary care because it lowers the cost for them, for their families. And so check it out if you haven't checked out direct primary care.
Yeah.
Well, you are not only experts medically, but you're also parents. So I want to hear about your family. Tell us about your family.
Yeah. Do you wanna jump in on that, or
Sure.
Yeah.
So there's a family of 4, and we got a dog, but we have 2
The
kids.
dog counts.
Dog counts. We have 2 kids, Ethan and Hannah, so they're 18 and 16, junior and senior in high school. So
Can you believe you've made it?
No,
to that
well, I don't feel like we've made it
place?
yet because, oh my gosh,
There's
the
so much to
college
do.
applications and the keeping the grades up. I mean, they're good. They're good kids, but.
It's a lot.
I know today we're going to talk about managing stress for little kids, but if you ever want us to come back and talk about teenagers, I'm ready for it. It's something.
It's a different level of stress.
I feel like there's the rose-colored glasses as you get older. So you
Right.
look back, and so you're going to ask me about, what was it like newborn? Oh, it was great.
Yeah.
No problems.
Yeah.
Ask me about teenage life. We've got some different opinions on that. And all joking aside, it's going great. But
Yeah, they're good.
There's some struggles.
They are good.
So
It is different. I was always feeling the pain of the late nights. The late nights were so hard for me when they were teenagers and all their friends and up late, and I would just be so exhausted all the time because my
sports. Sometimes not even eating dinner until 10 o'clock, and we try really hard to eat as a family, but it's hard as they get older.
Very hard.
Yeah.
Yes.
Yeah. But they're also driving now too. So that has been a new paradigm shift for us.
Yeah,
So
that helps.
we don't have to
Well,
shift them around.
we always felt the pain of when they do start driving. You know that your talk time is about over.
Yeah, that's
Because,
true. That's true.
That's you parents who are driving your young teens around. Enjoy the moment. As much as it's hard to be in the car all the time, you really don't get to talk as much.
Yes.
Once they start.
It's true.
And when they start driving on their own, it's like, you don't see them. You have to really figure out how to talk.
And I feel like that's why the dinners are so much more precious now because, and not all families can do that because of work schedules or whatever. And a lot of days we can't do it, but you're right. You don't have that one-on-one time with them anymore when they are on the go.
Yeah. So enjoy those drives.
Yeah.
Yes.
And I know it was hard. I remember, packing 4 other kids in the car to go pick the oldest one up across town that took me 45 minutes to get to.
Yeah.
And you're just tired, all that running around.
Yes.
It's exhausting.
Just feel like a chauffeur.
Yes, you do. Yeah. Or the 5 a.m. swim practices.
Our kids never did swim, so I'm a little thankful for that.
Yes, for sure. So what's the favorite piece of advice you've been given as a dad or as a mom? Like, lots of people love to share advice, but is there something that helped you as a parent? Can you think back to some advice you got?
I think when our kids were little, one of the things that my mother-in-law told me was you just have to enjoy the little things. Like, I think we get so caught up in worrying, are we doing it right? What are we doing wrong? What are we missing? And like the day-to-day minutia of everything, you forget, like, just enjoy that they're saying, like our son used to say, granola bar, nolaga bar. And I thought it was hilarious. And I was like, I should make a little list of all these funny things because I'm never going to remember. But just like pulling a little joy from your stressful days in the little things.
That's such good advice.
Your mom was such a good mom.
Well, she was. Yeah. She really was. I think the thing maybe it's advice or something I realized over the life, as I was getting older with my children, was that sometimes I would try to emulate or have them emulate what my life was like when I was a kid, and try to kind of shoehorn that in and say, well, I did this, and so therefore they should do that. But what I realized over time was that you can't change personalities. They're their own people.
That's right.
And your experience is going to be different today than certainly what it was, in our case, 20, 30 years ago. Yeah. And so it's okay to have some grace with that and say, you know what, just love them, guide them, and let the chips fall where they may with regards to how they develop. And that's something I think I've evolved over time with, and realized that it's okay to not be, that they forge their own path and their own experience, and not always in your what you envision it to be.
Right. Because as parents, when we share, like, well, when I was younger, this, da-da-da-da-da-da, our kids go, they roll their eyes.
That's right.
That you really have to help them be on their own journey and experience their own things.
Yeah. And allow them to explore those things that maybe you don't know anything about. Yeah. And that's okay too.
Now, parents, you all listening, young parents, you have such a different road to travel than we did. As parents, but you have so much information, almost too much information available, and it's confusing to navigate that. So, thinking about young parents, the way you all support professionally as physicians, young parents, what are some things you've observed that are helpful for young parents to know? Like, what are some things that...
I think you're right about this overwhelming amount of information that parents have. Like, when our kids were little, we had What to Expect.
When you're expecting, the What to Expect books, right? And you just follow that.
Yeah, and the joke would be like, the baby doesn't come with a book. Oh, well, there's this book, and you can read this book, and that's your guide. But it's so different now. I mean, everywhere you turn, it's... social media posts or experts in certain fields telling you this or telling you that. And it's really hard to sort through what should I trust? And you see what your friends are doing, and well, they're doing this sleep method, and I don't know if that's the right thing for my child. And so I think finding your making sure that you're seeking out reliable resources, and of course, turn to your doctors, right? Like, we're here to help you, your pediatrician, your family doctor, your OBGYN. Yeah. If there's a certain thing that you're really worried about or struggling with, go to the experts in your lives and ask them to help you sort through all the stuff that's out there.
And you should be with a physician that you align with.
Yes.
Because I see that topic of conversation a lot in moms groups. And today there's a lot of moms Facebook groups that they find each other and talk. But, sometimes a mom needs a certain physician that aligns with her beliefs or a dad's beliefs system, and it should be a partnership working together.
Yeah. We have to be able to collaborate, and we want, of course, we want patients who, we can, of course, spend more time with and get to know them and get to know their family and understand what their goals are and what's important to them. But it's,
Do you feel like there's tips moms need when they're pregnant, like things that are helpful for them to do or not do? Because I think there's a lot of pressure there, too, on that whole journey of being pregnant. Now there's a lot of information, lots of do's and don'ts. I
don't know what your favorite resource is, but I really like...
The question was about moms.
You have mom patience.
You're like, I'm out.
From a personal perspective, you're much better to answer this.
I have my certain favorite reliable resources because there's so many. When you're pregnant, everybody has a lot of the same questions, right? Like,
and other people have lots to tell you.
Yes. So a plug for ACOG, the American College of Obstetrics and Gynecology. They actually have a wonderful website where you can look up anything to do with pregnancy, and they have these big, long pages of frequently asked questions, and just about anything you can imagine, you can go, and they're such a trusted resource. So I point patients to them all the time.
There's another trusted resource, not just pregnancy, but what's coming with like a newborn baby, is the CDC actually has a lot of great videos and developmental things on their website, and many people don't know about it. And it's just talking about development. It's nothing controversial, because I know the CDC can be controversial, but it's just really a helpful tool.
That's great.
I think it's more important to also think about consensus within the medical community and really go towards that as your guiding post, because without consensus takes a long time. So science, or medical science and research, and then which eventually leads to consensus, could take decades. But over that time, you can trust that the consensus statement, meaning the kind of the views of the experts who've all come together in a room and said, okay, we can agree that this is appropriate. That takes a ton of energy and a ton of time. And I think for the most part, you can trust that. But once you move outside consensus, you're a little bit into the world of what we used to jokingly call dude-based medicine, which is that dude told me. Which is okay. And that's how medicine and science gets pushed forward. There's new ideas come to the fore, and people go, hey, that's a great idea. We need to test that. But if you really want to ground yourself and remove some of that anxiety of the chatter, go to the consensus ACOG, College of Obstetricians, go to American Academy of Pediatrics, go to the American Academy of Family Practitioners, go to the CDC. Look at what the experts and consensus statements are and start your journey there. And because that will quell anxiety pretty quickly, as opposed to bouncing around on YouTube or Instagram or what have you.
And there's a lot going on right now, for sure, for parents to navigate. So I think hearing you say, partner with your physician, ask your questions, use reliable sources, that's a really good. Good recommendation.
And I think there's so many things too that you'll hear on social media or you'll see people talk about in pregnancy, that just when it comes down to it, you don't have to put yourself through all this stress. Like caffeine is a great example. We've always been told, or certainly when I was pregnant, it was, avoid caffeine, stop all caffeine use. Well, really, if you look at the research, if you understand, you can have a cup of coffee or a cup of tea a day. It's okay.
Just don't go overboard.
Exactly. Everything in moderation. Yes, are there certain things that we know can be unsafe for a pregnant woman or for the unborn baby? Yes, there's certain things you should avoid. Like you probably shouldn't be eating sushi. I'm sorry. But, but little things. A little bit of caffeine.
I'm always shocked at the lunch meat thing, because there were several pregnancies being really, really sick. The only thing I could do was eat sandwiches. I felt like I never normally ate sandwiches, but it was like I lived on, I think at the time, I had one pregnancy in Texas, and Quiznos was new. That was like a sub play. And they heated the subs.
What happened to Quiznos? Anyway,
I don't know. That's a different topic. But man, those Quiznos subs helped me through 2 pregnancies. I'm like, I'd be like lost if I couldn't eat sandwich meat. And you poor moms now can't eat sandwich meat.
Or at least in moderation. Make sure it's not expired. And you know, because the concern is for the bacteria that can grow in there, right? And yes, we probably all need to eat less processed meat. That's a different conversation.
Yeah, that is.
Yes.
That is. But sometimes you're just trying to survive, right?
Yes.
You have to eat when you're pregnant.
And you can't, and don't beat yourself up about the little things.
Yeah, I used to work home health, so that's hence why the Quiznos came into play.
You're on the go.
On the go.
Yes.
And I think the other thing to understand is that it's a natural process, and this whole like pregnancy and parenting has been going on for a long, long, long time, and people have gotten through it. And of course, there's new things that come to the fore, but at the end of the day, you know, give yourself grace and take a deep breath and realize it's gonna be okay.
Yes.
That you saying that it's been going on a long time, that really helped me as a first time mom, remembering when I was pregnant, ready to deliver, the overwhelming feeling of, how am I going to do this? What am I going to, you know, and I have to remind myself, oh, women have done this since humans were first created. We have, they have done it without medicine. They have done it. If they can do it, I can do it.
Yeah. And we've all been helping each other since that time. And I think that's so important to remember is when you feel like you're on your own, or you feel like there's nobody that you're getting all this information, you don't know who to talk to. And don't forget your friends and your family too.
Right.
You know,
one of my favorite shows, Call the Midwife.
Oh yeah.
I love that
That's
show.
a great show. Yeah.
I love that show because it really is women helping other women. And there were men, a male doctor.
Yes.
But it just, we've been doing it for a long time, helping each other. So once a mom has a baby, what do you see as one of the biggest challenges for young moms? And what do you think is something they face a lot today?
Well, I think, there's so many changes that happen after the baby is born, right? I mean, you've gone from, especially with your first, you know, you've gone from being a couple for most mothers, you know, you're in a relationship and you have these set roles and life is working in a certain way. And then this little person shows up and everything
disrupts it
absolutely changes. Right.
Yeah.
And in those early weeks and months, especially, you know, you're sleep deprived, your emotions are changing, your relationship has changed, the way you're interacting with your spouse and your family and your friends is changing.
The tears, the sweat, night sweats, if you're nursing, all of that.
And I think it's just so different. You don't know who you are anymore sometimes, and that's really that would be my message to parents or mothers, especially of newborns, but dads too. I mean, I think we talk a lot about the changes that happen with mom, but dads are going through it too, just in a different way. That you really have to work through figuring out what your new routine is going to be. What are there changes in the relationship? There are changes with each of you as an individual, and sorting through that is hard and stressful, and everybody goes through it.
And it may be the first time dads are walking into a grocery store buying products they've never bought before.
Yes, right.
I know. I remember that with my husband. I need you to go get this, and this. And it's the first time he really had to do that. You know, I needed help. He had to go get the things.
Exactly.
I remember one of the, I mean, this is more of an economic thing, but at the time, you know, in terms of breastfeeding, we were breastfeed for a while, but then we had to switch over to formula. And I remember walking in and going, man, this is expensive stuff. And I it's one of those moments, I don't know why, but I just remember walking out with a bunch of formula and going, how does anybody do this?
And the
diapers and this whole thing. And when you're a young family and you don't have much money anyway, and you were in residency, and, you know, it was, you know,
it's good points, different things.
For whatever reason, I remember that when you said the grocery store, those are things I went to get, and that was my role. And you know, some food here and other things too. But for whatever reason, I remember that.
We didn't quite have the just order it and it shows up at your door back then.
That's right.
That's one thing you all have now.
Yeah, that is super helpful, super convenient. Yeah.
But there's still times where you got to run. You need it now, and you got to send one of the parents has to go to the store to get it.
Yes,
for sure.
Right. Exactly.
Yeah.
Yeah. It's a good point though, how in the stereotypical, parental roles, the dads are certainly worrying about other things than what the moms are consumed with. And
so there's a lot of talk, moms think about emotional part of becoming a mom, but there's also postpartum depression. That's a real thing. Absolutely. That is much more talked about now. And I think women should find support for that. So can you tell us, how do you support women, or how do you help them know, is this postpartum depression? Do they need help?
Yeah. It's very, I think the first thing that I would say is it's so common. And there's a spectrum, of course. Almost everybody will go through some degree of mood change after the baby is born.
Yeah.
And that could be something as simple as just being irritable because you're so sleep deprived. And that, that's not necessarily postpartum depression, but it's really normal and really common. And postpartum blues, where it comes and goes. You're having good days and bad days, and you're tired, and you're a little moody, and you're sad and you don't know why, or you're happy. It's just this roller coaster of emotions. That's, of course, really normal. But for a lot of women, it becomes progressively worse. And I think that's when it's important to reach out for help. If every day is a bad day, if you're feeling really isolated or withdrawn, if you feel like you're not connecting with the people around you, you don't feel supported, you're, of course, if you're having really dark, negative thoughts, like, I don't know if I can go on.
Yeah, that's alarming.
These are things that, it's not normal. It's common, but it's not normal. And you should be reaching out to your family doctor, your OBGYN, or even your pediatrician. For some women, maybe the only doctor that they're seeing in the short term is their child's pediatrician.
And their pediatrician can refer them or help them know the right steps. So speak up if that's you. And I can remember, depending on what season your child's born, if you have a winter baby, just it happens to be an overcast day today, and that overcast feeling adds to your mood. One of the things I appreciate today is just the beauty in the postpartum body that is more accepted now. Because I can remember feeling so, having this big poochy belly and my body doesn't feel or look like, I always say you get the inner tube around you, the way you pack on your little fat bubble in the inner tube, which protects the baby. And it just doesn't feel good. It made me feel like not myself. Like
I think there's a lot more pride in that now. And
right.
Yeah. I remember our kids coming up to me, and when they were little, and,
touching.
They'd push on your belly and go, "Mommy, your belly's squishy." I'd be like, "Well, yeah, that's from you." But
and I still think, I call it the war or the mom scars, just I had 5 babies. My stomach does not look pretty.
It's never the same.
No,
but it's okay.
Still have that squishy belly.
Yes,
no matter how many sit-ups
you do
or workout.
Sorry to break it to you, but
so there's some part of it that's an acceptance and a beauty, and that's what I love. So if you're going to watch stories, moms, watch those stories of women that are talking about the beauty of the postpartum body and the experience and the scars and the wounds that are on your body. It's part of the beauty of becoming a mom.
And dads
have the dad bod too.
There you go.
Not to be left out.
You eat the cookies.
That's right.
I remember Jim would always be pounding the cookies.
Well, and dads can be supportive of the moms too.
As we eat more, exactly.
But as they're,
we need to hear we're still beautiful, right? From our dad, from our husband.
Absolutely.
Exactly.
Absolutely.
Saying that. Because we question it. After our body's been through it.
That's right.
For sure. Well, that's good advice for young moms to hear that. And then what are some ways dads go through changes, and I love that some dads get paternity leave. That's really cool that they get to be a part of things, the new life starting out. And I loved things like, even though I was breastfeeding, letting dads every day feed a bottle at least to have that bonding time. And I loved doing that for my husband. But what are some things that have been meaningful to you as a dad?
Well, I mean, I think that in the entirety of my children's lives, or early on in life, I don't know. I have fond memories of being involved like that, and I was able to feed the baby. You give several bottles, obviously, and change the diapers. I felt like I was the diaper king, and it was something I embraced. It's funny. I have friends who are like, "Now I never touch a change of diaper."
Never touch it.
I thought to myself, that was the thing that I could really. I felt like that was the. Maybe I'll get hate for this, but the ickiest part of this concept of raising a child, and I was happy to embrace it if it helped my wife in that moment. I didn't mind.
That's really kind and sweet.
I know that's kind of it's a small example, but I felt that was something I could easily do. And we were having a conversation, just prior to coming out about just how kids change in the first 9 months. There's not much going on. Let's say first 12 months, the kid is pretty immobile. They start to crawl, but they're not up and running around and toddling. So things start to change for the roles of the parent as the child starts to move around. It becomes more of a nuisance with regards to getting into everything, which is good and bad. So dads then become more mobile and more helpful that way because the child doesn't need to be near mom all the time.
Dads are the best play buddies.
Definitely.
Rough and tumble and being the fun guy and which is fun.
Cracking heads open. I mean, that's what I remember, in a good way. We rough and tumble, but then, invariably there's some injuries that are associated with that.
Sometimes they roll off the bed or whatever.
True.
Or Jim was cutting the grass one time with our first on his back, and a branch came back and smacked him right in the face, and he had this big scratch on his face. And things happen, but he loved cutting the grass with Dad.
Yes.
Yep, absolutely.
Being in that
absolutely.
backpack.
Yeah. So those are the things I think that dads are pretty good.
And I remember a huge help to me, and something that dads can do, is sharing the burden of getting up at night.
Yes.
And maybe the mom is nursing and she has to be up to do that, but the dad can also take a turn to change the diaper or to get mom a drink or something and just help her feel supported.
Or I know we used to plan a bottle. I would pump before I went to sleep.
Yes.
And if I just needed to try to sleep 6 or 7 hours straight, because I knew it was going to get me through the next day, he would do the bottle. I'd pump before I went to bed, and
it's such a huge help. Because when you're nursing, I mean, you're up, and especially when the baby's little and you're both still getting the hang of it. I mean, it might take you 45 minutes to nurse. Yeah. And then by the time the baby's back to sleep and you're back to sleep, you're waking up again.
Yeah, it's 2 hours later and you're up. It's so true.
So, I think dads can be a huge help in that regard too.
Yeah, that's good. Yeah. So past the little stage, just support in early parenting, when you think about a lot of parents, both are working, both have to return to work after that newborn stage, and parents are overwhelmed. But what are some ways or things you've observed that, just the mental health when you think about young parents today? And I think about their school loans and the cost of living, and all the things are, I think, harder maybe than when we were younger. But what do you observe, and what are some helpful things from a medical perspective that can be helpful to young parents?
I think in all stages of life, I would just take it. It's kind of I tell my patients, it's the put the mask on before helping others concept in the airplane.
That's
I don't
good,
think you can't put a dollar sign, or you can't put a value on how important it is to take care of yourself, even in the throes of knowing that I've got this person who's completely dependent upon me. Because ultimately, if you wilt away because you're not taking care of yourself, and what I mean by that is, just keep it simple stuff. Get as much sleep as you can. It's natural not to get as much sleep when you're young, but that's because you're young and it's okay. That's all right. But trying to eat healthily as much as you can, getting physical activity, doesn't have to be a lot, walk 20 minutes a day, just get outside. If you can, leave baby with spouse or vice versa, get out and do something. Spend time to to be mindful about your environment and what's going on in life, so that you don't get overwhelmed or catastrophize about all the things that people get worried about, particularly in the social media. I pick on social media, but just the information age, let's say. People have a deluge of information that they can constantly access. And so taking some time out from that too. Right. And just being able to really take care of yourself is so important. So that's
and I think for the marriage too, you've got to prioritize marriage, because adding a baby in the mix, just like marriage is learning how to be less selfish. Like that's the whole, I think, gist of marriage is learning how to put your preferences down and serve the other one. Same with after you have a baby, you're working together on this new adventure of being parents, but you've got to prioritize your marriage. You have to take time. And a lot of people will say, well, I don't have anybody to keep the baby. Well, find one, find someone, build a village, find people around you, because it's that important to still date and still, even if it's going out, it may not be, maybe you don't have the finances to do a big expensive dinner or anything like that. There's still so many things. We would do creative dates. Like one time we had somebody who had a jet ski that said, hey, you can borrow the jet ski. And we just took a bag dinner that we packed and went and jet skied for free on a lake. And, just finding things to do that keep you having fun together and having that connection that you need as young parents.
I agree. Yeah. I mean, I think that was something that was helpful for us, was just, even if it was only one night a month, just to go do something away from the kids and try not to talk about them the whole time.
Right.
If you can. It's inevitable, I think, usually. But
or you say, okay, for 30 minutes, we'll talk about them, and then we're going to move on to something else.
Yes. But even something as simple as taking a walk, or like you said, find your village. You especially if you're working, somebody's going to be watching your kids. Now, maybe you're lucky enough to have a family member who can do that, but maybe you're at a daycare, and then that's an opportunity to meet other parents of kids of similar age.
Right.
And you can trade off and say, hey, I'll watch little Johnny for a couple of hours so you guys can go get coffee. Yeah. And then maybe next week you can do the same for me. And then there's, you're not having to pay a babysitter. Right. As you said, it doesn't have to be fancy. Right. You can just take that time and be together and try to connect as a couple, not just as parents.
And that reminded me a tip that my husband and I used to do, because we were on a very tight budget at some of the stages of our, having a newborn and kids. But we would hire like a responsible middle school student. And, like I called him a mommy's helper, and she would come over and help me get I can think of one that came into our life when we had 4 kids and it was busy, but we would put all the kids down and then we would go out on a date and she would stay there. Yeah. And then she slowly learned, it was like backward chaining, slowly learned a little bit more, a little bit more, a little bit more, till her whole 6th grade year, she learned the whole evening routine. By the time she was in 7th grade, she was a very mature, responsible girl, but she didn't have a lot of extracurricular activities that kept her, she was able to babysit for us. And she was so great. She learned the whole routine. Eventually, she could put them all to bed and we could actually go out at dinner time. But we started doing that, just going out after they were all in bed. Yeah. And she was helping with the routine, which made it easier. And, you do what you can. And she wasn't super expensive. Yeah. And it was we counted on a date night. We did it every week. And it was great. And sometimes maybe we didn't really get much food or spend much money, but it was just time together. Yes.
And you get a little bit of a break. Yes. You can breathe and not feel like you're on high alert all the time. Who wants me? I think dads get this too, but I think moms especially, it's mom. Right. You can't go to the bathroom alone. You can't, take a shower alone. Right. Just to be able to have a little quiet, is nice.
So self-care, really important in your marriage. Yes. Really important.
Definitely.
Yes. So that's good. So a lot of moms, think it gets easier after infancy, but then the toddler years come.
Oh, the toddlers.
The toddler years. And I disagree. It's not 2-year-olds. I think it's more 4-year-olds.
I totally agree. 3 and 4 is worse.
4 is like, they're smart little cookies.
Yes.
They know.
And they know what they want.
They do.
And they can tell you what they want.
They're manipulative and cunning, and you've got to, like, all of a sudden outsmart them.
And they're strong.
Uh-huh. There's so many things about 4-year-olds.
Yes.
2-year-olds, I think it's just the art of distraction.
Yeah.
You just distract them. Don't get into little struggles with them, you know? But what advice do you have for moms, like, navigating that toddlerhood? Like, moving out of infancy to toddlerhood?
I think toddlerhood is intense. There's a lot of emotions. Their personalities are developing. They're, like I said, they can tell you what they want, and they can definitely tell you what they don't want. And there's a whole new shift in what you're working on, and it's their personal development of things like toilet training and how to behave, and they're learning what's right and what's wrong. They don't really understand it yet, but they're learning. And I think remembering that you're learning too as a parent is a good reminder when you feel like, oh my gosh, my kid's going to be in jail by the time they're 13. Just remind yourself that it like, you're not doing anything wrong. You're learning to tap into those resources. Just take a breath. Don't ever hesitate to just stop and take a breath.
Yeah. When
that 4-year-old is,
I used to say, mommy's got to go to timeout.
Yeah.
And I put myself in timeout.
Yeah.
Because sometimes it's a lot.
Tag out with your partner if they're there. Just be like, hey, I need to take a walk. Yeah. You know, you're up. You're it.
Yeah, and I think that is something, dads are so helpful, you know, a lot of the outside play, you know, so we can get things inside done sometimes. I mean, I love to go outside and throw balls and play ball and do all that too, but sometimes it is helpful to tag team in that respect. And now I feel like kids don't get a lot of active time outside of school or out, you know, maybe they're in daycare. They have to go outside or have to have free play, but, you know, they need a lot of time, a lot of physical energy, and just encouraging families to put away the screens and put away the phones and get outside and play. And, and we don't see a lot of kids outside anymore. Yeah. Like, they're not there, but we have amazing park systems too in our area. Wherever you live, there's got to be parks or even woods or adventurous things to do, and it's fun to go on adventures.
I think you would agree. I mean, I think if there was anything that we could do differently, if we could go back in time, it would be to wait on the phones as long as possible and the screens. You know, I'm sure I know you see this too. You know, we have. And in the doctor's office, it's a little different because you're trying to get things accomplished, and you're trying to talk to the doc, and we're non-judgmental. We totally understand when sometimes you just need to put on Bluey for a few minutes so that you can talk about what's going on. That's okay. But my concern is when the iPad is the fix for everything, I would be very cautious about that. Yeah, I'm not anti screens, but in moderation. Yeah, you know, it's the screens have their purpose. It's absolutely fine when you're at your breaking point and you need something safe for the child to do, for your toddler, and you know that you can put on a show and walk away and get some laundry done or rest or read for 30 minutes. Totally fine. But I think especially as they get into that school age, waiting as long as you can on the phones is critical.
It really is, because there's almost no way. I mean, I heard there is a surge of the flip phone again, but you know, if you could just have a flip phone and not have the internet attached to it, that would be nice, because that's the whole problem, is the freedom. There's just so many negative things that kids don't need to be exposed to and emotionally aren't ready for. And,
for sure.
You know,
I mean, I think it has to be kind of a cultural movement, community movement.
I think so too.
One thing that, we tried the flip phone. That lasted about 2 weeks. And what we realized is that the problem is the flip phone as a technology is not it doesn't integrate with their friends' technology. So you end up having this problem with because the whole village isn't doing it, the kids then get marginalized because they don't have the technology to be able to communicate with a smartphone because the flip phone doesn't have a certain app or what have you. And it's not like we gave our kids cell phones when they were 4, but probably middle school age they started getting them. I don't know if I don't disagree with what we talked about at all. I think the Luddite in me, the part of me that says, well, maybe we're just being old timey sometimes, and maybe that's a bad thing to say as a doctor. But what I think we need to do is also take a holistic approach to technology and recognize it's here. It's not going anywhere. So we have to figure out a way, on a community level, as parents, like what is enough. Is having a cell phone in 6th grade okay? We should debate that. And it looks like as data comes out, probably there's going to be more negatives than positives about this stuff. Giving social media as you get older is probably a better option. But how do you do that when we collectively right now are still milling around and really captivated by the technology and not grouping and saying, okay, we understand the technology, now let's as a community, let's put this out as a culture. Let's put this out in a stepwise fashion. Once we achieve that, which I think will be generational. My kids' generation,
I would agree.
They've sailed away, and they're going to be great. I guarantee they're going to be great. But they're going to be different than the next generation who's going to come along and realize how to navigate around the technology. So I'm not anti.
See some of the movement happening. I mean, I hear it and see it, and our youngest, as you know, is 21, and he actually had a friend who, didn't have any technology, no cell phone till high school, till later in high school. And that was unusual for that generation, but that kid's well adjusted.
He's done okay.
Did great, very social, did fine. And it was a smart move on the parents' part. And, also something we did, again, we did parent in a different era than you all. Our kids are older, but the moms listening, we just decided to not do screens Sunday through Friday. And when they got home from school Friday, that's when they could do. And at that time, yes, there were phones, but there weren't as much on a phone as there is now. And we didn't do any screens, no computer games. There were a lot of computer learning games, which were good. We didn't do TV even. And it was their job to figure out what to do. And most of the time it was just playing outside. It was reading. It was doing your art or your music or whatever you're interested in. And they just learned to deal with it. And our adult kids, especially the boys, come back and thank us. They said, we see our friends all addicted to video games. And we didn't have that. We didn't have that video gaming in the house. Now, we did have it later. The youngest one got some of it, but I would say he's not addicted to it. He does enjoy playing with his friends, but he's a very successful kid.
Sure. And I think this, especially as your kids are moving from toddler age into school age, I think really being mindful about how they are interacting with screens is really important because, and don't forget that even when you're you're tired, you're at the end of the day, something as simple as reading a story together. If you make that part of the bed, thinking about the stressful times in the day when you have young kids, turning off the screens, doing something quiet to help them wind down will pay dividends. And it's not only helpful in the moment when you're physically winding down with them, getting ready for bed, you're bonding. It's a calm activity that you can incorporate into your daily routine. You're also teaching them how to relax, how to get to sleep, how to self-soothe without
how to have a bedtime routine that helps you.
Because we see so many school-age kids even now. It used to be a teenage problem, but so many school-age kids who they can't sleep, but they're on screens until the very moment that the light goes out. And sometimes after. Sometimes they're going to bed with the iPad. And it just, it really wrecks their ability as they age.
And there's TVs in their room. There's TVs in their room, and they're, screens are everywhere, and I agree. And there's so much anxiety and depression.
Yes.
And so parents, if you don't want your kids struggling with anxiety and depression, that's where the hard conversation about screens come in.
It is hard.
And it doesn't mean that kids that don't have screens at all don't deal with anxiety and depression.
Of course.
But I think I've watched professionally, it heightened and very increased because of the amount of screen use and just what it does neurologically to our brains and to a young child's brain, that limiting that screen time and definitely not having it in the evening is a good way to go.
Yeah. It feels, especially when your kids are little, it feels like an easy, nice way to get a break. And sometimes it is. But when it starts to become part of the everyday routine, I would just caution you to try to step back.
And I think we'd be remiss if we didn't talk one thing about being a toddler and development and calming and skill building is that keeping it on the simple page is read to your children.
Yeah.
I mean, there's good evidence to suggest that just reading to your children helps with a whole multitude of developmental, it has developmental advantages.
Right.
And it's easy, it's cheap. It pretty much captures what we just talked about as a way to calm down, to self-soothe. So that's something that can be done as early as you really want, right?
And those of you with multiple kids, I can say my husband and I, we read in the hallway between their rooms and read to all of them. So the 2-year-old heard what the 8-year-old was hearing or whatever, that we just read classical books and it really works. It's a great way to help them wind down and also, you know, kids listening to books or books on tape, those are good too. If it's a night where you can't physically be by their bed reading, you can have them listen to stories too. Yeah. It's good. So what message would you share with young parents that feel so overwhelmed? It feels like they don't have hope. What message would you share with them?
I think that you're not alone. And that would be the first thing, is that everybody goes through this to some degree. You're not alone. You're not the first person that has felt this. You definitely won't be the last. And to take strength from that and to say, okay, who can I reach out to? Who can help me? Because you don't, even if you live far from family, even if maybe you've moved recently or you don't have a close-knit friend network, I think more than ever, there are ways that you can find your people. And that's whether it's a mommy group or whether it's a group in your church community or at your gym or at your doctor's office. I mean, you could meet people anywhere. You know, if you just go to the playground and spot a parent with a kid, your kid's age, and just say hello. Don't be afraid to say hello.
Right.
Sometimes it can feel a little scary, but. And
you make a good point. I think that is why there's still so many people attending church. Church is community. It's a connection of people, and it is a place. If you don't go to church, you might consider it. You might consider checking that out, because it is a place where you really can find connection and community and people that are willing to stand by you when you're in a hard time. Yeah, for sure.
Yeah, I think there's lots of opportunity to find that support, and don't be afraid to ask for help. I think so many moms and dads feel like, well, I have to do it. I'm not strong enough, or there's something wrong with me. Why can't I get through my day? Why can't I get all these things done? But I think the pressure to be perfect is overwhelming sometimes. And it is just not reality. What you see on Instagram is not real life. This is curated for your entertainment, and you need to just check that reality sometimes.
And I'll just echo that, I think the first step is recognizing you're not alone. The second step is recognizing you do have control. And the control may be asking for help. And that's incredibly empowering knowing that I'm making a step forward, and that step forward is I'm asking for help. So I am in control. I'm seeking out tools to help me make myself better. And And those are all, self-fulfilling.
So when a parent comes to you and saying, I need help as a physician, what do you do? What are your steps? How do you help them?
Yeah, I mean, I think the first step for us is just listening. And tell me what you're struggling with. Is it a mental health problem? Is it because stress? I always like to explain depression and anxiety as everybody has stress in their lives, right?
Yeah, and
for some people, when you look at it from the outside, some people can take on an immense amount of stress, and their brains can cope with it. And I don't know how sometimes, but they're able to do it. And for other people,
steady eddies.
For other people, smaller amounts of stress, it's really difficult for them. And I always remind people that it's not a personal failure. This is just the way that your brain and your body are dealing with stress, and those symptoms might be. So we want to hear what are you struggling with? Is it, are you having trouble sleeping? Are you sleeping all the time? Is your appetite disrupted? Are you having trouble with focus? Are you having trouble with task completion? Are you having physical symptoms like headaches or upset stomach? These can all be downstream effects of stress. Are you having those dark negative thoughts? And then we see what the symptoms are, and then we say, okay, what is the best? What are the treatment options? And it's not always medication. Medication has its place, and it can definitely be helpful. It's not always medication. But then we use that as a jumping off point to say, all right, what do we need to do? And maybe it's counseling. Maybe it's putting them in connection with some sort of social group. Maybe it's reminding them what their resources are. And
it feels like everybody, if you haven't done counseling, everybody should try it, because it's so much less of the negative stigma than it was. I know when I was growing up or years ago. Now it's really helpful. And what's so cool is if you don't have the energy to drive and go somewhere, you really can do it online.
Yes.
And you can feel connected to your counselor online. And it's easy. You can do it when you put the kids down to bed. Sometimes there's people who are available in the evenings, all different times of the day or weekend or whatever. So it's really easy to get, I think, some counseling, some help, and most insurance plans cover it.
That's right.
And a lot of people don't know that. It's super helpful.
Yeah, I think the online thing is really quite, it's a huge use case for telehealth, is online counseling. Yeah. Now, I would, if people feel comfortable going to in-person counseling, I think that's a great option.
It is.
I think it's wonderful to talk to somebody face-to-face, human connection. You're in the same room. There's really no substitute for that. However, the barrier of entry to get online is so low. Yeah. Now, I'll tell a little story. When I was in the military, because I practiced in the military for 7 years, and I was in a family medicine residency program where I taught, and we had something called a BHOP program, which is behavioral. I'll think with the acronyms. There's a lot of acronyms in the military, but anyway, this program, the idea was really about was putting mental health in the primary care space. So we had great counselors really right next door to me, and I remember some of the, how I would say, my mentors of them of the mental health. My mentors of mental health would say things like, if they got a sprained ankle, have them come say hi. Which was the point was, it doesn't matter who you are or what your problem is.
Right.
Everybody can be helped by a human connection and talking to a trained professional who can help them through their things. Yeah. That conversation may happen for a few minutes and say, hey, it sounds like you're doing great. Yeah. Good job. I'm here for you.
Because a sprained ankle could actually be a stressor because they have goals they want to meet, and this ankle's not letting them meet their goal.
Exactly. And so I really took a lot from that, which is a shame because we don't put primary care and mental health in the same physical space as often as we should. And there's a lot of reasons for that.
There's a lot of talk right now about doing just that, about really getting mental health in primary care. There's a lot of talk about that.
And I always remind people, when you see a counselor, it's not like in the movies, right? Like you're not laying on the couch and you might talk about your childhood a little bit, but it's not that kind of cold, distant, let me only talk about my feelings kind of
Right.
stuff. It's practical. It's strategies for how do I deal when I feel like I'm going to blow my top. What can I do? It's practical things that they're teaching you that are really useful.
Yeah.
And yes, you'll talk about feelings.
And I think women are more wired and ready to go to counseling than men. I mean, men, at least in my observation, they think it's weak, or I'm going to have to cry or share my feelings. And, I don't want to do that. And they need to know, no, actually, you don't. It's not going to be all mushy, feely, all of that. It's, like you said, it can be some just cognitive skills that help your mental health and help your well-being.
Yes.
And strategies to help.
I think for the guys that I see, I'd kind of reframe it as a kind of executive coaching.
Yeah.
It seems more masculine that way.
Yes, it is.
And they say, it's executive. I'm going to be an executive. Yes. Or, meaning executive functioning, not that you're a CEO or something, but just the idea that it's not counseling. It's I don't know why we need to change the names, but sometimes it just falls better with that. And that's great if that helps people go. And almost without fail, they come back and say, thanks a lot. That was really helpful.
Yeah.
I didn't know what I didn't know. And so
that's good.
So we're a little off topic with the moms and such, but I think it applies to dads too, right? Like dads can have similar life changes, and when baby's born and going through the ages and stages as a child gets older. And so all of that is helpful.
Well, many dads get hit with, I am now the provider. Like they know they're the provider, but it's at least that's what I see a lot of times, that really hits them hard in here. Like, it's my job to provide for this family. It's a masculine wiring, like, to do that, to be even if the woman is a higher income provider than the man, it still doesn't matter. It's a wiring, the provision, the protection,
the planning for the future.
Yeah.
I think probably, I'm sure you could say, but I think the men probably do tend to take that on a little bit more.
Which is one of the reasons why they don't want to go to counseling.
Yeah.
Right.
Like, I don't want to spend the money.
Yeah, right.
And then we have to talk through that a little bit. Why, does that make sense? Why doesn't it make sense? But I hear them, I understand. But women, I think, are less, if we look at utilization of healthcare services, men tend not to. But part of that is because of we don't want to ask for directions concept. Right. But part of it also is, am I going to waste time and money? Yeah. And I don't want to do that. I think women are more, and this is a broad generalization, I know, but I think this is just kind of anecdotally we see in our clinic, women, and I think if you studied this too, I think they show that women utilize healthcare services more. They're just more accepting of that and opening up and letting their defenses down, so to speak, so that they can get help. And I would just echo to my guys out there, please reach out. Men of a certain age probably should all see a doctor. Certainly earlier in life is fine, but you reach kind of your let's say 40, I don't know, pick on 40. There's things that start changing, and we're getting off topic, but it's okay. You can reach out to your doctor and say. And
it goes back to the self-care that you said.
Exactly.
Make sure that you're taking care of yourself so that you can take care of your family. Right.
And I think this is also a generalization, but women tend to struggle with insecurity and men tend to struggle with pride. And that makes sense in counseling, because if we're insecure, we want to go figure out how to get secure. And men don't really want to drop their pride to go talk to someone or get help or admit they need help.
Yeah. With all that said, I think it is getting better.
Yes.
I think men are much more apt to go out. And again, telehealth seems to break that barrier down. It's anonymous. And it's anonymous if you go to your local. But I've had many people who travel out of town because they don't want to be seen.
Right.
Like, I live and work in this town. I don't want to go there. Right. And I understand all that. But now telehealth, you can break that barrier right down.
Because you can just be in your home and talk to someone, which is great. Yeah. These are all really good tips. I love what was loud is you're not alone. Moms and dads out there, you're not alone. Yep. We all have struggles in this journey of parenthood, and talk to your medical providers, talk to people who know and love you, and get the help. Admit you need help and get the help you need.
We do it all day long. I mean, so much of our practice is helping people through mental health stressors, whether it's temporary or long-term. It's much more common than you realize.
Yeah. Well, I'm so glad you're able to help so many people.
Thank you.
And help me. You've been a big help to our family.
You're
welcome. So thanks for coming on today.
Thanks for having us.
Yeah.
It's been fun.
Thanks so much for listening to Help, I Have Kids. If you're tuning into this podcast, that means you're a mom who's curious, committed, and ready to learn. And we see you. We'd love for you to join our Help, I Have Kids Facebook community, where moms just like you are connecting, asking questions, and encouraging each other every day. It's a space for real conversations, expert insight, and support from moms who get it, because we're all in this together. And if you know a mom who's feeling unsure or maybe overwhelmed, or just needs to be reminded that she can do it, she can advocate for her child with confidence, share this episode with her. We're building a village here, and we're glad you're a part of it.